All right, welcome again to today's Mobility Monday. I'm Jeff Blanchard, Therapeutic Associates, physical therapist, and I wanted to talk to you today a little bit more about the hip and about hip pain. Oftentimes, patients will come in with a diagnosis of hip pain, and yet when they come in, that hip pain can be in a number of different locations. Depending on where your location of hip pain is, that can help you know probably where your pain is coming from, and we're going to get a little bit more into where is that pain actually coming from. So as I've talked about in some previous episodes, pain location doesn't necessarily mean that the pain problem or the problematic structure is right underneath the pain. So here's an example that everybody knows. Everybody knows that if you have a heart attack, where do you feel pain? Oftentimes, you might get some in the chest here, but oftentimes it's down into the left arm. Obviously, your heart's not in your left arm. It's what we call referred pain. And pain behaves in that way. You might feel a pain in a certain location, but actually the problem is a different location in your body. So we're going to be talking today mainly about the three different sides of the hip and what's probably going on if pain is found in one of these areas. So the first area we're going to talk about is anterior or in the front of the hip. So what does it mean if your pain is right in the front of the hip? Now, a little bit of anatomy again. There's my pelvis. Okay, so if we're looking at the hip joint, you can see that the hip joint itself is actually right here in the front of the hip. We've got this bone that's further out to the side, and people will come in and say, my hip pain is right here. I must be getting arthritis in my hip. And I'll say, well, if your hip pain's out there, it's probably not arthritis, because usually that pain is felt right here, which is right at the spot where that joint is. So that's point number one. If the pain is in the front, and you're over the age of, say, 45 to 50 to 55, chances are you're dealing with some joint breakdown pain, maybe some arthritis at the hip. So what is arthritis? Arthritis is the loss of cartilage at a joint, which then leads to inflammation, which then leads to pain. Okay, so you can have loss of cartilage but have no pain and no inflammation. Well, then we just call it degeneration, but we don't actually call it true arthritis until the pain comes on due to the cartilage getting worn down, and now you're starting to get extra forces through the bone, and that's what actually causes the pain. So again, if you're over the age of, say, 45, 50, 55 typically, and the pain is in the front location of the hip, oftentimes it's going to be some arthritis. There's various tests that we can do with you here in the clinic, not necessarily with an x-ray, to be able to tell you that yes, in fact, you probably are dealing with some arthritis, and we would then advise you what's the next thing you should do. What if you are younger than at that age and you're getting pain through here? So there are two main issues that could potentially create the pain in that location. One is that if you got your hip ball and socket joint, that you are getting some pinching in the front of the hip. So sometimes what is the case is your anatomy is a little bit creating a problem. So either the socket is too deep, so you have what's called a pincer lesion. So we've got a too deep of a socket where the rim of the socket is too close to the bone. And so when the leg comes up in this manner, you bang into the rim of the socket. So you come up and you bang up into the rim because the rim is too large, or the socket is too deep. So that would be one. The other problem would be what we call a cam lesion, which is where the bone, the femur, right around through here is too fat. And so it therefore connects too quickly with the rim of the socket. So we get the same problem. We get what's called an impingement of the hip in the front of the hip in this direction. And so you can be somebody who's young And just because of the anatomy, the way the anatomy is set up, you're getting some impingement of the front of the hip. That is something that sometimes will respond to physical therapy, and sometimes a surgery needs to take place in order to take care of that issue. The next thing is that around the socket, there is a ring of cartilage called the labrum. And that ring of cartilage can sometimes get damaged and can either peel off a little bit or get folded under, and that could be another source of pinching. So sometimes we have a labrum problem in the hip, which could be the source of a front hip pain. That's the front of the hip. Now, let's go to the side of the hip. Somebody comes in and they say, this is where my pain is. It's right here. I can't lay on that side, it gives me pain, or when I walk, it gives me pain. 9 times out of 10, the problem is the muscle tendon connection right here to the bone. So the muscle starts here and it comes down to the bone. This muscle is your gluteus medius and your gluteus minimus. So these muscles help hold those two bones together every time you step on that side. And so if they're not doing the job, then the pelvis is yanking on that spot and it can create irritation over time. There's also a bursa in that area. So people might be diagnosed with bursitis. They've recently found, though, that it's much more common to have a tendon problem than it is to have a bursal problem. A bursitis is just less common in this area. We'll talk in future episodes of what you can actually do if this is your diagnosis. What are some things that you can do to start working on that? The last area of the hip is on the back side, here. Somebody might come in and say, I have hip pain, and it's right here, even though that's nowhere near the hip joint. So we don't really call that hip pain. It is kind of the buttock area, and so you might call it the hip. The hip is this big area. But usually when there's pain in the back area of the hip, it's coming from the back. So when the spine is having pain or having trouble, oftentimes you'll feel the pain in a different location. You might feel it maybe in your back, you might feel it right in the butt, or you might feel it going down the leg, which is what we will call, what's called sciatica, which we've talked about in the past. So on the back side, again, that could be a back issue causing pain to the back of the hip. It can be a sacroiliac issue. So the sacroiliac joint is formed here between the sacrum and the ilium. So that can be creating some of that pain in the back. Or it might be some of the muscles of the hip. We could have the piriformis is back here. Maybe there's a strain of the muscles. Or the last thing is maybe it's the hamstring that attaches to the base, basically the base of the buttock to this bone, and people can get a tendonitis right there at that spot, causing pain right in the butt. That might be another source of what somebody might call hip pain. So a lot of different sides of the hip, a lot of different problems that could potentially be causing these issues. And again, in some future episodes, we'll talk about each of these 3 areas a little bit more in depth. And so then you can know what you need to do in order to start working on some of these things with some exercises and with some stretching in order to hopefully take care of it, or come in and see us. That's always an option. So thanks for joining me today for today's episode of Mobility Monday. If you know anybody who's having hip pain, front, side, or back, then share this episode with them and some of the future episodes where we're going to be talking about where your hip pain is coming from and what you can do to better deal with your hip pain. Subscribe to our channel, give us a thumbs up, and remember, until next time, motion is lotion.